Namaste. What is coccydynia? The tailbone area becomes very painful. So how many vertebrae are there in the lumbar? 5 vertebrae. Sacrum? 5. God, we cannot explain his architecture. This is the chassis like of any vehicle. Here in the sacrum, what he has done? He has fused the sacrum. How many numbers of vertebrae are there? 5. Are they always 5? No. They can vary. They can be 4, they can be 5. Sometimes if the sacrum is big, it will give off one vertebrae, and that is causing the lumbarization of the S1 vertebra, which looks like lumbar 6 vertebra. Suppose it is very small, sacrum is small, absorption of the last L5 vertebra, and that is called as sacralization. Have you seen very long sacrococcygeal length? You would have seen, but if you had not noticed, it's because the eyes do not see what the mind does not know. Coccydynia can be due to, in most of the cases, we see it's due to trauma, a fall, an accident. Sometimes it presents like a missed trauma, like many other fractures are there. There are contusions, there are other signs are all there. Sometimes we miss them, and they come at a later presentation with severe pain, not able to sit. Today our topic is non-traumatic. There is no trauma. Why can coccydynia occur? If you have a short notes for the undergraduates or the postgraduate students who are writing exams, coccydynia is pain in the last vertebrae, coccyx, and then go that is strain, sprain, fractures, non-traumatic cases, and give the treatment as a ring. These are very good. That's enough to pass. But if you want to excel, I will tell you my life experiences. The patients which I have seen. I got a patient. He was having coccydynia. Ischial bones, the ischium, both sides, that is the sitting bone. They are called as sitting bones. The coccyx is the posterior tripod. What is the tripod of a stand? Okay, in the front, the ischial bones will sit, and posteriorly, the coccyx will. This is how we sit. Now, if the sacrococcygeal length is increased by birth, of course, then what happens? It is like this. They are not yet on weight bearing, but is already weight bearing. Naturally causes pressure, causes pain. Now, the sacral segments are all fused, and from the foramina, the nerves are coming out. Now, around the nerves, they can be a perineural cyst, or inside the canal, hiatus, there can be a perineural cyst. Peri means around, neural, nerve, cyst, in the coverings of the nerve root. There is a sac-like distension, pressure, causing severe pain. It's like a nerve root which is getting entrapped, cause scalloping, and it can cause a severe pain in this region. So sometimes it may be confusing whether to call it a real coccydynia or a sacral pain. So only a person, a clinician, orthopedic surgeon, who puts his hand and sees, he or she only will identify the true site of pain. Why am I saying this? Today, unfortunately, clinicians are seldom touching the patients. Very, very bad. You don't want to miss a diagnosis. Please make the patient lie down prone, lightly palpate, and you will have all the information even before an X-ray is made. That's what makes you a perfect doctor. Please look up what is a Tarlow cyst, why it is difficult, what is the recurrence rate, how does it come. This I have seen in a lady who came with back pain, severe back pain and buttock pain, anal pain. Next, I got a 21 years delivery boy. He had pain, severe pain in the sacrum. I took an X-ray. LS spine was normal and everything was normal, when suddenly something caught my eye. That's why again I'll tell you, take your time, zoom. Just don't look at the X-ray just like that, it's a normal, move, next, no. Zoom, look at it more clearly, especially when a patient is in severe pain. Please spend some time, a few more seconds or few more minutes. What I found was anterior sacrum was breached. This anterior sacrum here was breached, and I found that there's a cortical break, and somehow I was not happy. So I talked with my radiologist, and it was confirmed that there is a probability of a malignancy. I sent for an MRI, and finally when it was done, there was a big mass developing in the anterior part of the sacrum, causing coccydynia and also sacral pain, low backache. So I told him, immediately go, rush to your home country, and he went there. He got the surgery done, absolute radio silence, not contact on WhatsApp, nowhere. After 7 months he surfaced thanking me. Then he showed me the x-rays. They had resected till S2. So I felt very happy for him, and I was surprised by the way he was resuming his delivery food. For 3 months he was good. He was coming back for reviews. Then he started coming again with pain. I again did the clinical examination. Unfortunately, the first segment of sacrum and somehow the L5 also seemed to be getting involved. So it was a recurrence. What was the diagnosis? Chordoma. Chordoma, locally very malignant tumor, can recur. The survival rate is quite limited. Hope to see him recover, but that's how it is. Why am I telling you this? It's just a short note. So somebody asks coccydynia. Don't take it light. Coccydynia can destroy a person's daily life. They can't sit. They can't get up. They can't. It's horrible. It's just horrible. Using a ring or no ring. In my own experience, I can tell you one thing. I had coccydynia once, and I was only able to sit on one side of the buttock. So finally I realized when I'm sitting like this, the pain was so much because it was coming into contact. So when I sat a little stooped forward, bent forward, my center of gravity was not going through the coccyx but going through the thighs, and the pain was vanishing. So this is what I tell all my patients. Please, it's like lifting your tail on a humorous side. So these are all things: anal sphincter exercises and a ring when possible, avoidance of hard seating, and also too much depth sitting on sofas which are high cushion, then you can't get up. Now I would like to talk to you about cauda equina. Slow form of cauda equina can cause anal pain and mimic coccydynia. So anybody having coccydynia, please, or anal pain or paresthesias, be very careful. This could be a warning sign of a sudden catastrophe and loss of sphincters control, lower limb control. Now, once we finish these three things, I would like to talk about the morphological changes. What are the morphological changes which can cause coccydynia? I'm talking about the sacrum and the coccyx. Now, sacrum has 5 segments, one box over the other, which are fused. Now, there may be situations where they are not fused, so causing hypermobility. The sacrum is a triangular plate, 5 fused sacral vertebrae. Now, these 5 fused sacral vertebrae are shaped so that the biomechanical forces, it disperses into the sacroiliac joint. Now, let's come to the intersegmental regions. Sometimes they may remain unfused, so creating little mobility. Another situation is between the sacrum and coccyx, it is usually fused in males. Why? Because males, there is no need for excess mobility at that region compared to a female who has to undergo deliveries, and deliveries need ligament laxity, expansion of the pelvic wall, the pelvic cavity, so that the baby can come out through the normal way of cervical presentation. If it is fused in a female, it will create a lot of problems. 1. 2. Intercoccygeal mobility, intercoccygeal subluxation, intercoccygeal scoliosis. See, so many things are there. So my friends, the coccyx is the center point of attachment of many muscles and tendons. It is the attachment center for the pelvic floor, which can become lax after many deliveries or obese people, many other reasons. So doing pelvic exercises called as Kegel exercises can help relieve coccydynia. Anal exercises relieves coccydynia. So many things. Posture, just a forward stoop when you work can help. It helped me. I hope it works for you. If it doesn't work for you, pain is increasing, don't do it.
I'm enclosing a few more causes of coccydynia, of which pilonidal sinus must not be forgotten. Also, a stiff coccyx due to ankylosing spondylitis is well established as seen in this reference. Infections of the coccyx could be my last point, a pointer towards coccydynia.
So these are all the non-traumatic causes of coccydynia. We seniors must spread knowledge and empower the medical students to perform very well. When we teach better, we have better doctors. Thank you so much.